Acronyms and abbreviation. Introduction. In this module, we will learn about the acronyms and their abbreviations that are frequently used by healthcare professionals. Topics to be covered. About acronyms and abbreviations. General acronyms and abbreviation list. Acronyms and abbreviation list by specialty. About acronyms and abbreviations. Definition of acronyms and abbreviation. Acronyms. An acronym is a word composed of the first letters of the words in a phrase, especially when this is used as a name. For example, HCP is an acronym which stands for Healthcare Professional. Abbreviation. An abbreviation is a shortened form of a written word. Abbreviations may be used to save space and time, to avoid repetition of long words and phrases, or simply to conform to conventional usage. For example, Dr. or Prof. Why study acronyms and abbreviation? It is an irrefutable fact that the doctor's speech is full of abbreviations and acronyms. Healthcare professionals from all over the world use at least 10 abbreviations per minute. This high prevalence has led us to consider it as a challenging pandemic. Hence, we are studying abbreviations that are commonly used in the healthcare profession. General acronyms and abbreviation list. General list. 5-FU. 5-fluorouracil. ABPA. Allergic bronchopulmonary. ACE. Angiotensin-converting enzyme. ACL. Antibodies to cardiolipin. ACTH. Adrenocorticotropic hormone. ADH. Antidiuretic hormone. ADPKD. Autosomal dominant polycystic kidney. AF. Atrial fibrillation. AFP. Alpha-fetoprotein. AML. Acute myeloid leukemia. ANA. Antinuclear antibodies. APCs. Atrial premature complexes. ARDS. Acute respiratory distress syndrome. ARF. Acute renal failure. BAL. Bronchoalveolar lavage. BCC. Basal cell carcinoma. BMT. Bone marrow transplant. CBD. Common bile duct. CCK. Cholecystokinin. CD. Crohn disease. CF. Cystic fibrosis. CML. Chronic myeloid leukemia. CP. Cicatricial pemphigoid. CRF. Chronic renal failure. CSF. Colony stimulating factor. CT. Computed tomography. CTX. Cholera toxin. CXR. Chest X-ray. DH. Dermatitis herpetiformis. DRA. Dialysis-related amyloidosis. DU. Duodenal ulcer. DVT. Deep venous thrombosis. EBV. Epstein-Barr virus. ECG. Electrocardiogram. EGD. Esophagogastrodiadonoscopy. ESRD. End-stage renal disease. FAP. Familiar amyloid polyneuropathies. FMF. Familial Mediterranean fever. FSH. Follicle-stimulating hormone. GCT. Germ cell tumor. GFR. Glomerular filtration rate. GH. Growth hormone. GHRH. Growth hormone releasing hormone. GI. Gastrin inhibitory peptide. GU. Gastric ulcer. HBV. Hepatitis B virus. HCG. Human chronic gonadotropin. HCV. Hepatitis C virus. HPV. Human papillomavirus. HSC, hematopoietic stem cell. HUS, hemolytic uremic syndrome. IBD, inflammatory bowel disease. IBS, irritable bowel syndrome. IL, interleukin. ILD, interstitial lung disease. JN, juvenile nephronophthisis. LA, lupus anticoagulant. LBBB, left bundle branch block. LDH, lactate dehydrogenase. LES, lower esophageal sphincter. LH, luteinizing hormone. MCD, medullary cystic disease. MCD, minimal change disease. MCV, mean corpuscular volume. MR, magnetic resonance. MRI, magnetic resonance imaging. NUD, non-ulcer dyspepsia. OA, osteoarthritis. OCG, oral cholecystography. OSA, obstructive sleep apnea. PAN, polyarteritis nodosa. PF, pemphigus foliaceus. PG, pemphigoid gestationis. PIF, prolactin inhibitory factor. PRA, plasma inactivity. PRL, prolactin. PSA, psoriatic arthritis. PSA, prostate-specific antigen. PTE, pulmonary thromboembolism. PTH, parathyroid hormone. PV, pemphigus vulgaris. RA, rheumatoid arthritis. RBBB, right bundle branch block. RBC, red blood cell. RPRF, rapidly progressive renal failure. RTA, renal tubular acidosis. RV, residual volume. RVT, renal vein thrombosis. SBC, secondary biliary cirrhosis. SCC, squamous cell carcinoma. SI, ceramide. SBP, spontaneous bacterial peritonitis. SSC, systemic sclerosis. TB, tuberculosis. TBB, transbronchial biopsy. TLC, total lung capacity. TMF, tumor necrosis factor. TSH, thyroid stimulating hormone. TTA, transtracheal aspiration. UC, ulcerative colitis. US, ultrasonography. VATS, video-assisted thoracic surgery. VC, vital capacity. VF, ventricular fibrillation. VIP, vasoactive intestinal peptide. VPCs, ventricular premature complexes. WDHA syndrome, watery diarrhea, hypokalemia, and aclohydria syndrome. WBC, white